So many people ask all the time, what is therapy? WTF is therapy or psychotherapy or coaching or intervention or behavioral modification or CBT or EMDR or psychodynamic psychotherapy or whatever piece of alphabet soup and gobbledygook you're keen on or looking at understanding. People really don't know what therapy is. Not to say I exactly know. It's not an agreed upon definition. So today I was compelled to speak to and provide a little bit more content with regards to how we help ourselves or how we help others in the confines, context, or frame of psychotherapy. What is it actually? What is it that's not agreed upon? And what is it that we can do to change somebody substantively in a long-lasting way, in a way that affects their personality, in a way that affects their relational life, in a way that affects the people they get along with, in a way that affects their family, in a way that affects their job? These are all the things that people come to therapy for, and yet we cannot agree. Probably because it's always case by case, probably because it's idiosyncratic, probably because there's a lot of other irons in the fire and their interests, to mix metaphor, supersede those of genuine, meaningful developmental care. So with that started, maybe the first place to join in is to understand what we're doing. What changes inside the context of somebody pursuing a better understanding, a richer understanding of what therapy is. And to do so, they have to be within a frame. I think that should be something that's agreed upon, but maybe it isn't. Maybe I'm being controversial. Maybe I'm being biased towards my own training. But if the neutrality of the frame, that is the sanctuary in which somebody can use to get to know themselves, get to know their own humanity, get to know their inner conflicts, get to know what makes them them without a polluting or diluting component of the psychologist, psychotherapist, psychoanalyst, coach's needs, without the desires, without the biases, without the concern, without the pressure, without the dog in the fight. There is a meaningful difference between having blood in the water, feeling what somebody else feels, and being ahead of them, having a dog in the fight, a desire to change them for them. A meaningful difference. I think something that's lost very often in what interventions look like or actually are in service of developmental therapy, that is the process of somebody striving towards becoming themselves, to feel safe to do so, to feel effective, to feel authentic, to feel permitted. It's incumbent, it's contingent upon the frame that's supplied by the therapist. If there isn't room for that person to explore all the facets of themselves, if the trust isn't there, if there's taboo anxieties, if there are parts of the human experience that have been disavowed by the therapist themselves, they're not going to go. Right? The patient cannot be ahead of the therapist, nor can the therapist, quite similarly, be ahead of the patient or client. If they are stemming from a position of authority, from a position of knowing better, from a position of not alignment, of not attuned, of not parallel, then they are going to be robbing the patient or client of the discovery that is necessary to facilitate movement forward. This process is experiential. And I think that's something that's very, very lost on therapists, patients, coaches, influencers alike. It is not something intellectual. It is not something that can be read in a book. It's not something that could be given to somebody, so to speak. It is a process of heavy lifting, much more akin to training for the marathon, learning to ride the bike, learning to paint, or learning another language. It is multimodal learning, incumbent upon unlearning or relearning things from the past. The past is what informs the present. This isn't dredging up trauma in service of injury or re-injury. This isn't skewing towards the future, participating in the future in a manner that is in service of ideals and the devaluing of what's currently going on. There's no shortcut about it. There's no way to intervene anywhere else but where the patient is at. And if the practitioner is inadvertently, unconsciously, blindly participating in some manner that allows for or permits the patient to stay or the client to stay the same, we're not doing our fucking jobs, bar none. And that's the problem. This shit is complicated. Understanding the human experience is as complicated as it is complex. And in the connotation of information theory, we're speaking to the complications like a Swiss watch and the complexity of emergent properties like traffic, like consciousness, like the organization of a perturbation of birds like swallows as they move through the sky. This is something greater than the sum of its parts. And if we're not attuned to the facets and layers in 3 dimensions or maybe 4 dimensions, we're gonna have a bad time. So how do you teach it? How do you practice it? Well, there's 4 pillars that I often speak to in helping people in this, be it other therapists or patients. Supervision, that's training or education, that's personal therapy, and that's practice. And without all of that, if you're missing a pillar, if you're not in good therapy, which you might not know, maybe ask them if you're allowed to be mad at them is one metric. If you don't feel safe to be mad at your therapist, again, you don't feel safe to be yourself entirely. You're human with them. If you're not practicing in service of understanding the work and learning from patients, clients, you're missing something. If you're not in effective class or exposing yourself to literature, you're missing something. And of course, if you're not in supervision in a way that's teaching you the technique, teaching you the analytic stance, teaching you how to be in the room, something's going to be missing. So who is this video for? Both, I think this video is for people that are interested in psychology, and we will be having interviews with people who practice, people who train, people who teach, and those who are patients, myself included, that are keen on understanding where their suffering is coming from, understanding their way of being in a manner that is inclusive of all of the things going on inside of them, especially in heart, especially those things that are operating underneath perception. The reality is so much is happening, and this is substantiated in the literature over and over again. The unconscious isn't a location you'll see on an fMRI. The unconscious is a qualifier or descriptor of a reality of the topography and anatomy of your own brain, mind, heart, spirit, and soul. It's real, and no different than the autonomic systems or dynamics in your own body. You don't feel your blood pressure. You don't consciously put one foot in front of the other once it's a learned behavior, of course, but a toddler does. You're not aware of all sorts of processes going on because you don't feel them until they become out of homeostatic equilibrium. Once they're skewed, too hot, too cold, like the shower knob, you'll start to feel them. And that strong drive to put things back into an organized manner, right? The strong drive to stay alive supersedes so much of our lives, even in terms of how much we're conscious of. That is to say, it costs less energy, it's less effortful to keep things rote and unconscious and automated or automatized. It takes more energy to become aware. And so we will always be defending against that. Be you a practitioner, or be you a patient, or be you a layperson interested in psychology, or what the fuck is going on in the world, as I said. So what is therapy, to sum this all up? It's healing. It's really just healing. It's not coping. And I think that's the big difference. Coping isn't bad. There's nothing wrong with coping. There are forms of quote unquote therapy that are about coping, about intervening, about changing a behavior, willful intentionality, action-oriented solutions, what have you. But if they're not inclusive of the totality of what makes you you, they're not going to be integrated in a meaningful way into the fabric of what makes somebody themselves, or seeping into the bones of where their mobilizing, animating, and driving forces are. Personality change is really fucking hard. Behavioral intervention, when we will ourselves to go to the gym at the start of the new year, is totally different. Deriving motivation from an external resource or reservoir. That's not the same thing, and we know that, but we fight against that, obviously, in our culture. How many mentors have I had in my life, in my career, that have spoken to the reality is the fastest way through the process of development is slowing the fuck down. Not optimizing, not speeding up, not cold plunges, not drinking matcha tea every morning. Not self-care and conflating the difference between self-image care and the real self-care. We don't know who the fuck we are half the time. And that's a scary proposition. I totally sympathize with that, but it is a reality. It is a reality, as frustrating as that might be to hear. So this work, what I hope is understanding what it is to heal the soul substantively, as Jim Hollis would say. What is it to restore meaning and function and the capacity to strive towards our own authentic and effective lives in this work. That's what invigorates me in doing this. That's what's mobilizing me to make these videos. I cannot wait to start showing you guys the interviews I have lined up, to get to know people who are meaning well, and maybe that are more popular, bring to light people who really are boots on the ground doing this, that have things to say of what it's like to be working on and working towards yourself substantively, earnestly, authentically, in reality, without all the shine, without all the polish, without, putting lipstick on a pig, so to speak, or polishing a stick of shit. Is it a stick? A log? I'm not quite sure. That's what I'm excited about. I hope I made some things a little bit more clear. I'm sure I made some things more confusing. I'm excited. It's invigorating me to illustrate to you the things that I felt or feel that are absent in understanding what healing of the soul, right, in the literal translation of psychotherapy or psyche and therapy, actually is. Psychology being the study of the soul. What is it that makes us us? Therapy is just as much about what makes you you as it is what makes you human. We are so much more alike than we are dissimilar. And we can't forget that, not in today's world.